All right, let's get into this. We're going to break down a pretty incredible study that found a way to take something we all do, leaving online reviews, and turn it into a super powerful tool for making hospitals better. Seriously, it's about changing simple clicks into actual better patient care.
I mean, it's a fair question, right? You take the time after a hospital visit, you tap out your experience on Google Maps, good, bad, or ugly, and you have to wonder, does anyone even see this? Well, according to this research, the answer is a huge, resounding yes, and it could change everything.
Look, hospitals have always known that patient feedback is critical, but think about how they used to get it. You know the drill, right? Paper surveys that show up in the mail weeks later, or maybe a phone call. The problem is, it's just too slow. By the time they spot a recurring issue, it's ancient history.
And that really gets us to the core of the problem for hospitals, that time lag. In healthcare, a problem that goes unnoticed for weeks can impact hundreds of people. What they desperately needed was a way to get a pulse on how patients are feeling, not next month, but right now.
And this slide just lays it out so clearly. On one side, you've got the old way, traditional surveys. They're slow, not many people fill them out, and the feedback can be a little, well, filtered. But on the other side, Google reviews. They happen in real time, there's a ton of them, and most importantly, they are completely unfiltered. It's the raw, honest truth.
So the researchers behind this study had this light bulb moment. They realized they were basically sitting on an untapped gold mine. All of those millions of reviews on Google Maps weren't just random complaints and praises. They were patient stories, just hiding there in plain sight.
And here's why that gold mine is so valuable. As the study points out, because these platforms are public, people feel free to be incredibly candid. You can say what you really think without worrying that it's going to affect your career down the line. It's pure, unvarnished opinion.
Okay, but that leads to the next giant hurdle, right? It's one thing to have all this data. It's a completely different challenge to make any sense of it. I mean, who has the time to manually read thousands and thousands of comments to spot a trend? It's just not possible. So, how'd they do it?
Simple. They didn't get a human to do it. They taught a machine how to read. They unleashed the power of artificial intelligence to sift through every single review and actually understand the feeling, the sentiment behind what people were writing.
Now, the fancy term for this is sentiment analysis, but honestly, it's pretty straightforward. You're basically training an AI to read a sentence like, "The doctor was great, but the front desk was a mess," and know that it's a mixed, probably negative review. It's about understanding nuance, but at a massive, massive scale.
And the specific AI they used for the job is a real powerhouse. It's a model from Google called BERT. What makes BERT so amazing is that it doesn't just read a sentence from left to right. It looks at the whole thing, words before, words after, all at once to understand the full context. It's a game changer.
And the results? Were they any good? Oh yeah. The model scored a 93.72% on its performance test. In the world of data science, that's not just good, that's an A+. It's officially rated as excellent. So long story short, they now had a super reliable way to automatically sort a mountain of reviews into good, bad, and neutral piles.
But just sorting the reviews isn't enough. You also need a way to see if things are suddenly getting worse. For that, they needed an alarm system. Think of it like a smoke detector, but instead of fire, it's sniffing for bad service.
And this smoke detector has a technical name. It's a P-control chart. The P just stands for proportion. All it does is track the percentage of negative reviews over time. As long as that percentage stays inside a normal range, everything's fine. But if it suddenly spikes and shoots past that range, beep, 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 the alarm goes off.
And this is exactly what it looks like. Check out the chart on the left. That's data from 2016 to 2022. See how the blue dots are just kind of bouncing around between the two red lines? That's a stable system. Now, look at the chart on the right for 2023. See those red squares? They've shot way above the top red line. That's not just a bad month. That's the statistical alarm bell ringing loud and clear that something is wrong.
So, with their AI reading the comments and their smoke detectors spotting the trends, what did they actually find? They applied this whole system to a big hospital over in Surabaya, Indonesia.
At first glance, the news seemed pretty decent. The AI found that more than 2/3 of all the reviews were positive. A hospital manager might see that and give themselves a pat on the back. But the real gold was hiding inside that other 30%. Now this is a Pareto chart. Its job is simple: show you the biggest problems first. And wow, the data here is just screaming at you. Look at that first bar on the left. It represents nearly 1/3 of every single complaint.
And what was it? One thing: long wait times and endless queues. That was patient enemy number one, by a mile.
This table breaks it down even more clearly. After wait times, the next biggest issue was unfriendly staff, and right behind that, unprofessional health workers. You put just those three things together, and you've accounted for over 60% of everything people were complaining about. All of a sudden, the hospital's problems weren't vague anymore. They were specific and targetable.
And if you really want to feel what patients were saying, just look at this word cloud from the negative reviews. The bigger the word, the more often it was used. You see these giant Indonesian words like pelayanan, which means service, lama, meaning long, nunggu for waiting. This isn't just data anymore. You can almost hear the collective sigh of frustration.
And at the end of the day, that's what this is all about. The study makes a powerful case that by using these tools, we can do more than just fix problems. We can actually start building healthcare systems that are designed around the patient, improving the experience for every single person who walks through the door.
What's so great about this whole approach is that the data points directly to the solutions. Problem, long queues. Solution, optimize patient flow, improve online signups. Problem, unfriendly staff. Solution, better training focused on a patient-first culture. The answers are right there in the complaints.
When you really stop and think about it, this method is kind of revolutionary. What it does is turn every single one of us, with a smartphone in our pocket, into a real-time quality inspector. Your feedback isn't just shouting into the void. It's an immediate data point that can actually drive change. And that leaves us with a pretty wild thought, doesn't it? The next time you leave a review for a clinic or a hospital, you're not just venting. If hospitals start using this kind of tech, that simple 1-star or 5-star review could be a genuine piece of the puzzle in building a better future for healthcare.
So there you have it. This breakdown was based on the research paper, A Hybrid Approach to Hospital Quality Monitoring based on Google Maps reviews, which was published in the International Journal of Data and Network Science.